Everyone, thank you for joining us this evening. I'm Christina Reynolds, and I work for Triple Crown, covering North and South Carolina. And today we have with us Dr. Vandergrift. And Dr. Vandergrift is the wonderful nutritionist behind all the formulation at Triple Crown. And he also does international equine consulting for nutrition work, and then has done his own company with nutraceuticals and supplements. So Dr. Vandergrift does a wonderful job presenting. I'm very, very happy to have him with us this evening. The topic he's going to cover is equine gut health, and we're going to specifically talk about leaky gut. And Dr. Vandergrift, if you want to, you can go ahead and take it away, and I hope everybody enjoys the talk this evening.
Okay. Well, thank you, Christina, and thank you, everybody, for joining us, and especially thank you for your patience. I'm of the age group, I am not all that technical savvy. When I get into these computers, trying to find the right button and where to go sometimes hangs me up, and I think that's probably what happened here. But anyway, what we're going to talk about tonight is gut health in horses, and how it relates to a lot of the common issues that I know that you deal with your horses and your clients. I know these are things that I deal with on a fairly regular basis, and that is behavioral issues such as horses with anxiety or hyperreactivity or noncompliance. Now, obviously, there's a lot of reasons why horses will have behavioral issues other than gut health. But tonight we're simply, going to address that more from a gut health standpoint. I think more and more people are starting to learn that allergies that some horses present with actually start in the gut, and it's a symptom of gut dysfunction. And so many these horses, when we can get the gut to work correctly and get it back to what we would consider normal, a lot of these allergies actually dissipate. And then, of course, straight digestive dysfunction, such as ulcers and so forth, and even insulin resistance. So we feel now that leaky gut may, in fact, be the very beginning of insulin resistance. So all of these different things have one common thread, and that is poor gut health. So we're going to divide up gut health rather, into three sections that I want to discuss tonight. We're going to talk about gastric ulcers, we're going to discuss dysbiosis, and then, as Christina mentioned, we're going to discuss leaky gut syndrome. The more we learn about these three things, the more we realize that you really can't talk about one without bringing in one or both of the others. They are all three very closely related, and any one by itself or any two or more in combination can result in a horse, as you see there in the picture on the right, that becomes a little bit hyperreactive and a little bit snarky, so to speak. Okay. So first, let's talk about the stomach. And I borrowed this slide, as you see down in the lower left-hand corner, from Dr. Frank Andrews, who's one of the leading experts on gastric ulcers in horses. It's a simple diagram, but it's important to understand that the stomach actually has what we refer to as a non-glandular region. And if you look at the picture over here on the right, I'm twirling my pointer around. The non-glandular region is the upper part of the stomach, and you can see that not only in this diagram, but in real life, there is a distinct difference in border between the non-glandular part of the stomach and the glandular part of the stomach. And that line that separates the two is referred to as the marcoplicatus. Now, horses can have ulcers in either the non-glandular part of the stomach, or they can have ulcers in the glandular part. So here's our same picture of the stomach with no ulcers, And you can see this is a fairly severe case of non-glandular ulcers. And this picture here on the far right, that's a pretty severe case of ulcers in the glandular region. And that's actually getting on down close to the pylorus, which back here in this diagram, the pylorus is the junction between the stomach and the small intestine. The duodenum is, and I think most of you are aware, is the very upper part of the very first section of the small intestine. So, and horses can have ulcers actually right here in this upper part of the duodenum. And those are treated just like you would treat a horse with glandular ulcers. But you can see that as a veterinarian, if your vet's going to take an endoscope and pass it down the esophagus into the stomach and try and make this turn and get back up here and get through the pylorus and actually get into the duodenum to see if there's any ulcers there, sometimes that's just not physically capable, or you just can't get it done. Sometimes you can, sometimes you can't. So even though we like to actually scope and see gastric ulcers in horses, due to some of the limitations we have with an individual horse and so forth, we can't always get a clear picture as was done in any one of these three photographs here. Now, non-glandular or ulcers in the non-glandular part of the stomach and ulcers in the glandular part of the stomach are treated differently. We used to basically, if we figured a horse had an ulcer anywhere in the stomach, we simply treated with omeprazole. And as we did that, we realized that we had many horses that were not responding very well. And that's when we realized that some of these ulcers down in the glandular part of the stomach, especially as we got closer to the pylorus, and then even if we got involvement with ulceration of the duodenum or the upper part of the small intestine, omeprazole simply wasn't giving us the resolve that we wanted. So keep in mind as we go through that omeprazole is quite good at treating non-glandular ulcers. It will still be incorporated usually in a medication protocol for glandular ulcers, but many glandular ulcers will also have additional medications added to them. And I would simply say in this regard, I would work with your vet, and I'm actually getting a little bit ahead of myself, but that's okay. I would work with your vet in terms of what he or she thinks is probably the most appropriate medication protocol if you end up with a horse that's got some glandular ulcers in the stomach or the upper part of the small intestine. Also keep in mind that the many products that are now on the market that are sold over the counter, primarily as nutraceuticals, all of these products primarily try to prevent ulcers in the non-glandular part of the stomach. Okay, so they are effective. Many of them can be effective at reducing the incidence of non-glandular ulcers, but when it comes to preventing glandular ulceration of the stomach, they begin to lose their effectiveness. Now, how do you know if your stomach, how do you know if your stomach's got a horse? Let me rephrase that. How do you know if your horse's stomach is developing ulcers? Some of the more common symptoms that they'll present with is they'll tend to get hyperreactive. They tend to get girthy. And what we mean by that is, as many of you are familiar with, that when you go to tighten up the cinch, they'll pin their ears. They may turn around and try to snap at you a little bit, may actually kick at you. In other words, they're going to give you a message that as you tighten the girth, that they no longer like that. Now, for some reason, that is very uncomfortable for them. Another symptom is that you'll notice that your horse begins to display some type of discomfort, either shortly after eating some type of feed or actually while consuming feed. Some horses will actually begin eating a grain meal whether it's a high oat, high starch type grain meal like you might see at the racetrack, or even a low starch feed that you might see, that's commonly used in a lot of our sport horses now. Either way, you might see a horse right in the middle of eating that meal just walk away, may even lay down and roll in severe cases, then get back up and start nibbling again. Or they may eat a little bit and just quit for an extended period of time and then come back. So in other words, their appetite or their feed intake rate slows way down. And then other horses simply have a poor appetite. So they just don't feel like eating quickly. They don't feel like eating on a regular basis. Okay, so if you suspect gastric ulcers, and this is where I got ahead of myself a little bit earlier, I do recommend that you do work with your vet and come up with a plan with your vet for the most effective treatment. I know sometimes we say, well, for my veterinarian to come out and actually, do an endoscopy examination or endoscopic examination on my horse's stomach, it's going to cost me as much as a round of GastroGuard, so I'm going to just treat with GastroGuard anyway. Well, if you're lucky, you might have some non-glandular ulcers, and the GastroGuard or the omeprazole might fix it. But at the same time, you might end up spending just as much on GastroGuard to realize that you had another issue, which the omeprazole or the GastroGuard did not cure. So if you treat with omeprazole, number one, be sure you use an effective dose. I run into this, that people are thinking, well, my horse doesn't seem that bad and this stuff is expensive, so I'll just do half a dose and see what happens. If you're going to treat, then treat your horse and use an effective dose. So if upon using a full protocol and your horse really hasn't gotten better, or maybe he or she did get better, but then reverted back quickly after you stopped the omeprazole, you may be dealing with another issue. In fact, glandular ulceration may be one of them. It may actually be a hindgut situation. And we'll talk about that more later on, such as leaky gut. But you can also have some non-intestinal issues, such as liver dysfunction. Can sometimes create some of these same symptoms. Or it could be a physical or a mental issue, and that would fall into the other category. So one of the things about trying to work with digestive function, trying to figure out what's the primary thing going on, it's easy to get stuck. And I love this little cartoon from Dr. Ornish. It's easy to get stuck trying to cure the symptoms and miss the opportunity to correct the primary cause. So if you happen to be the person down here in the water trying to cure the symptoms and you keep mopping up water, well, you're going to keep mopping up water until you do some preventive type medicine and get that water faucet turned off in the first place. And that's easy said, not so easy done. Because when we're dealing with hind gut issues such as leaky gut, excuse me, for example, right now we have no real exclusive marker that we could analyze for and say, aha, I've got leaky gut. So essentially what we have to do is go by symptoms, go by history, go by, client information, and try to figure out, is it a hindgut situation? Is it a gastric situation? Is it a combination of the two? And if it is a hindgut situation, how serious is it? Now, I'm going to have very few commercials, but I'm going to throw a few things in here as they do relate, because these are tools that you need to be aware of that you can help your horses prevent getting gastric ulcers. Calcea powder, for example, has been clinically proven to reduce severity and incidence of non-glandular ulcers. And the new Triple Crown Gold line, this is one of the things that we've incorporated into the Gold line. So you can take advantage of that ulcer prevention simply by using those products. Another Triple Crown product is the forage product called Stress Free. It's actually a nutraceutical product in forage form, which, to be honest, makes it unique. It's the only forage-based nutraceutical that I'm aware of that's available. It's alfalfa-based. Alfalfa has some natural buffers in it, but it also contains some other nutraceuticals such as glutamine, butyric acid, carnitine, and a good dose of prebiotics. And the claim to fame for stress-free, and no pun intended, is that horses that are stressed, for example, at horse shows or various type of events that tend to go off feed when they get, when they're transported and they get to a show, you can't get them to eat anything. You put some stress-free forage in front of them and they'll eat that before they'll eat anything else. And this has helped get more horses back on feed at horse shows than I can count. So it's a unique product, and it's been working quite well in that regard. Now let's go on to the second category, and this is dysbiosis. Now, it sounds like a fancy name. It's real simple, actually. Dysbiosis, biosis or bio, is simply referring to the microbiome. In other words, all of the bacteria, protozoa, fungi, etc., even viruses that make up the microorganism population or the microbiome in your horse's digestive system. So dysbiosis refers to a microbiome that has become dysfunctional. Now, we know from research that horses with insulin resistance have a different microbiome compared to normal horses or horses that are not insulin resistant. Now, the question is, which one came first? Did they get an abnormal microbiome and then develop insulin resistance due to that? Or is it due to the insulin resistance that they've developed a different microbiome? We don't really have all the answers to that yet. But as I indicated early on in the presentation, there's more and more evidence, not only in horses, but in other species as well, that leaky gut may in fact be one of the triggers for insulin resistance. So that would imply that a shift in the microbiome might happen first, and then insulin resistance is a result of that. Horses with allergies also will have a different microbiome compared to horses with non-allergies. Again, leaky gut intestinal inflammation is related to the development of allergies. So it's the dysbiosis that occurs first, allergies as a result of that. So you fix the microbiome and you can fix the allergies. Not in all cases, but we've got a pretty good success rate at being able to do exactly that. We know that horses with leaky gut have a different microbiome. In fact, it's the shift in the microbiome that often triggers the leaky gut situation. We also know that horses with behavioral issues also have a different microbiome compared to horses that tend to be more laid back and present with a more compliant behavior. So let's take a quick snapshot of the microbiome in the horse. The total bacterial population in the horse's microbiome is now estimated to be between 100 trillion and 1 quadrillion. And that's how many zeros 1 quadrillion is. Ladies and gentlemen, I don't know about you, I can't even get my mind wrapped around quadrillion. I don't normally refer or use the word quadrillion when I'm referring to my checking account balance, and I don't think anybody else does either. It's an extremely large number, obviously. So within that 100 trillion to 1 quadrillion total numbers, there's over 1,000 separate species of various bacteria and protozoa and organisms that make up the microbiome. Now, here's an important point. and that is most good bacteria in your horse's microbiome are anaerobic. In other words, they do not survive in the presence of oxygen. Therefore, the majority of the good bacteria that you want in your horse's microbiome are not suitable to be used as probiotics. A probiotic is something which we can orally feed or dose to stimulate a good microbiome diversity and population, but yet those bacteria essentially must be able to survive or remain somewhat viable in the presence of oxygen in order to be a product that you can orally dose. And as you can see, if most of our good bacteria are anaerobic, that's not going to facilitate them being used in a probiotic preparation. So how then do we go about helping proliferate and multiply these good anaerobic bacteria? Well, our researchers have discovered that the most effective way to do that is with prebiotics. A prebiotic is simply some type of substance which stimulates the growth and the multiplication, reproduction of bacteria and the other various good organisms in the microbiome. So, and I'm going to touch on this again later, but you right there, you should take home a very important point. If you're using prebiotics, you should use probiotics in combination. If you're using probiotics, you should certainly use prebiotics in combination. You should always use the two together. Another important point to remember is anytime the microbiome becomes unbalanced due to stress, antibiotic usage, for example, the first casualties are going to be those good anaerobic bacteria, the ones that are sometimes the hardest to replace. So this is important to understand because it helps you then begin to see what happens in the development of leaky gut. Okay. So also, dysbiosis is always associated with an altered microbiome and a less diverse microbiome. Now, what do I mean by less diverse? Going back to the fact that there's more than 1,000 separate species in a healthy microbiome. If we begin to lose some of our anaerobic bacteria in particular, we're also going to lose some of our aerobic bacteria that are part of the microbiome. Instead of having 1,100 different species, we now only have 800. And so it's less diverse. And diversity is a very good thing for a microbiome. It will improve your immune response. It reduces chances of gas colic, reduces chances of impaction colic, improves behavior, etc. So you always want diversity. And also keep in mind, there are bacteria, there's a microbiome component in every section of your horse's digestive tract, including the stomach. Sometimes we hear, the pH of the stomach is too acidic for bacteria to exist. Wrong. There are some bacteria that actually live and thrive in that very acidic stomach. In fact, some bad bacteria that can live in your stomach cause ulceration in people. Not so much in horses, but it has occurred in horses. So keep in mind that there are bacteria, there's a microbiome in every section: stomach, small intestine, large intestine. The particular makeup of that microbiome is going to be different in, say, the ventral colon versus, the duodenum, obviously, because there's a different function going on there, but you still need a viable microbiome throughout the entire digestive system. So that is something to, keep in mind and not lose track of. So when using probiotics, numbers do matter. Research indicates, and research is ongoing, so I want to kind of put a little bit of a disclaimer on that. But with our current understanding, it appears that 1 billion colony forming units, that's what the CFU stands for, 1 billion colony forming units per species is recommended to be used in any type of probiotic preparation. So don't get confused when you might look at a probiotic label and there's 5 different species of probiotic and they give you a total, and the total's 1 billion. Well, what's that mean? If you got 5 species and the total's 1 billion, then you don't have 1 billion of any one single strain, do you? What you want is at least 1 billion of each individual strain. So if you had 5 strains, you'd like to see your total colony forming units to be at least 5 billion. At least that would indicate that hopefully if you've got an equal distribution between the species of probiotics, that you've got at least 1 billion of each. Interestingly, though, not all probiotics need to be live to be effective. And this was some interesting research that was done at the University of Kentucky, where they actually autoclaved a bacterial or probiotic species that they knew was effective in the horse, and dead or alive, it was still effective at stimulating the growth and reproduction of other bacteria in the microbiome. Now, some of you that are hanging in there with me may be thinking right now, well, if it's a probiotic and it's dead, does that mean it's actually a prebiotic? And in my way of thinking, I'm on the same page as you. I think in that case, yes, that quote unquote probiotic, if you killed it and it's still able to proliferate good bacteria in the horse's microbiome, that's what a prebiotic does. So in that sense, it's acting just like a prebiotic rather than a probiotic. Sometimes you will see the term equine sourced, and for bacterial species used in a probiotic. Folks, don't get hung up on that. Plain and simple, that's a marketing gimmick. Most of your commercial probiotic strains that we know are effective in the horse are all sourced via bacterial fermentation. Okay. And also, I've personally been involved in some clinical studies and obviously keep myself up to date on other research in this area. But clinical studies that have compared quote unquote equine source strains of probiotics versus your commercially sourced strains are equally effective. So there's no real advantage to when somebody says this is equine sourced. You want to emphasize effectiveness rather than source or encapsulation or in viability. Do you have confidence in the company that you're purchasing those probiotics from, that they are offering you a probiotic strain that's effective and in the quantities that's going to actually be a benefit to your horse? That's what you want to know. Okay, prebiotics are ingredients that either support or stimulate the growth and reproduction of the beneficial bacteria in the microbiome. What are prebiotics? There's many different classes. There's glucans. That's what you primarily find in oat fiber. So oat fiber is a great source of prebiotics. The abernoxylans, you find that actually in wheat, wheat bran or wheat fiber. Hemicellulose, you find in forage. Pectins, you find in beet pulp. Mannan and fructan oligosaccharides are probably the more common prebiotics that are used in animal feeds as well as human products. Those are sourced primarily from yeast cell walls. Keep in mind, when we talk about yeast in terms of prebiotics, we're not really talking about baker's yeast. Okay, so I still run into people that say they're using a baker's yeast as a prebiotic, and that's real low mechanics, so to speak. That's real low technology. We've got much more effective prebiotic components that we can source and actually include in feeds and prebiotic, probiotic preparations. Interestingly, whole flax and flax lignans wheat bran, and beet pulp all contain prebiotic components. So these are some of the reasons why some of these ingredients have been popular in horse feed for such a long time. There's a new probiotic that's come available for horses. It's a very interesting one. This is a spore-forming probiotic. So it will only be effective if it's actually fed. It will not establish itself as a component of the microbiome unless it's continually fed. But it has some great advantages. And the biggest advantage is that this particular Bacillus subtilis strain, which was referred to as Clostat, will kill Clostridia. And, Clostridia difficile, for example, C. diff, can be a real issue, not only especially for young horses, but also for older horses. We feel that a lot of the enteritis cases that we see in horses is actually caused by Clostridia infection in the small intestine. And we know that then enteritis triggers dysbiosis and it triggers leaky gut. It will also reduce the diversity of your microbiome, as we already talked about, and that may in fact be the trigger for insulin resistance. So with this particular probiotic, we can reduce the Clostridia load should your horse come in contact with it. And it's always in contact with it. Clostridia is a pathogen of opportunity. It's always around. Your horse is always in contact with it. And should your horse get stressed out or some other event happen to reduce the diversity and or the numbers of the good bacteria in that microbiome, that's when the Clostridia basically say, okay, guys, the gate's open, let's go. And then they come in and proliferate and then create problems for your horse. So with the use of Clostat, we can always keep those Clostridia numbers down. We're going to talk about leaky gut. We're going to talk about something called tight junctions. Keep in mind that Clostat can help close those tight junctions, and it then also controls the bacteria, such as the Clostridia, that will tend to open those tight junctions up. So as I mentioned earlier, with microbiome support, prebiotics and probiotics is a good way to maintain a good, healthy microbiome. Never forget that the best way to support a good microbiome is to provide plenty of fermentable feedstuffs. So good quality forages, whether it's pasture or hay, is actually the best prebiotic that your horse can consume. I know that everybody's probably heard the old terminology, this horse simply needs Dr. Green, which simply means get him out there on pasture, let him, get some good grass, and that good grass has got lots of prebiotic components to it, as well as some other healthy nutrients that can help gut health in general. I do want to point out, though, that Triple Crown is the first equine feed company that's included effective levels of probiotics and prebiotics in their feeds that help support the horse's microbiome. And within the last few years, now they're also the first feed company to do that in combination with the addition of butyric acid and that new probiotic Clostat. And we're going to talk about butyric acid a little bit more as we go. Now, the third component of gut health or poor gut health, I should say, is something referred to as leaky gut. Now, what this diagram is illustrating, if I get my pointer going here, each one of these little depictions of a cell would be the epithelial cell of your intestine. And as you can see that these adjacent cells are tied together with a very complex structure called a tight junction. And so each one of these little red lines here connecting these cells that's your tight junction that we referred to. As you get inflammation in the intestine, those tight junctions let go, and talk about they open up, and this is where the term leaky comes from. Now, bacteria and other components inside the intestine itself can pass in between these cells and get into the blood. So your gut is now leaking. It's leaking constituents from the lumen of the intestine down into the bloodstream. That begins immediately to raise havoc with your immune system because you've got bacteria and other proteins now coming into the bloodstream that are not supposed to be there, and the immune system goes on high alert. Now, next week, we'll be talking about how leaky gut and allergies or immunity are all interrelated, and we'll go into this in a lot more detail. So I'd Can you hear me now? I think I got a message that we lost audio. Let me see here. Can anybody hear me? Oh dear. I'm sending Christine a text. Not getting anything back yet. Okay. Okay. Very good. So I understand we're back online. I apologize for that. Not sure what happened. But as I was mentioning, so I was going to tie leaky gut and gastric ulcers together and a few other things. And this is simply what we understand about this connection at this point. That if we have a horse that has non-responsive ulcers, in other words, whether it's omeprazole or it's a glandular ulceration, and we're using a more complex medication protocol, but we're not getting much response, or we get a response in the treatment, but as soon as we stop the treatment, these gastric ulcers return. Anytime we see that, we're pretty sure we've got a leaky gut situation, and here's what's happening. We now know that there is a particular messenger. It's glucagon-like peptide number 2 is what it's referred to. It's secreted by the lower part of the small intestine primarily, and it plays a role in communicating back to the stomach, essentially to let it know, that kind of says, hey, I'm busy down here. You slow down. You take a break. Stop producing so much acid. And so the various components of the gut communicate. That's something, another thing that I think is important to recognize and to understand. No part of the digestive tract works independent of the others. They're all communicating with each other. And the way they communicate is either via nerve connection or through some of these chemical messengers. So when we have leaky gut, we have intestinal inflammation, as we saw in that diagram, as you can appreciate, these chemical messengers either are not produced in adequate quantities, or they don't get delivered to the person, the organ that needs to receive that message, in this case being the stomach. So the stomach never gets word from the small intestine that it's supposed to take a break. And as a result, it just keeps producing acid even when it's not supposed to. And even though you're treating it with drugs that are supposed to reduce acid production, they help, but they don't clear it up. Or if they do clear it up, as soon as you stop the drug, the stomach's right back constantly producing acid. And it will continue to do so until you fix the leaky gut situation back in the small intestine and the large intestine, so that now that those parts of the digestive tract can once again communicate with each other, and everything starts to working in a synchronized manner the way it's supposed to. And then the gastric ulcers can get cleared up, and then they stay cleared up. So sometimes persistent gastric ulcers, this is our result of leaky gut. And that goes back to that cartoon that I showed you. And that is, you keep treating with omeprazole, you keep treating with misoprostol or whatever it is, whatever drugs you're using, all you're doing is sopping up the water. But meanwhile, the water faucet is still open wide and you're still getting flooded. So that's a good example of how those two work or fit together. Whoops, not sure what happened there. Sounds like I lost 2 slides. Okay. All kinds of technical difficulties tonight, Christina. It's a bad day. Okay. Leaky gut and allergies. And this is what we're going to talk about in much more detail next week. But horses that present with multiple either borderline or low positive allergies often suffer from leaky gut. And as we mentioned, as you can see, if you've got a lot of proteins and various components traveling through, let me go back to full screen. There we go. Traveling through the intestine and getting into the blood, that raises havoc with the immune system. Okay, so what can we do from a nutraceutical standpoint to either prevent or reverse leaky gut? One of the most effective nutraceutical components we can use is butyrate or butyric acid. And we use a commercial product called Butapearl. Butyric acid is normally produced in the intestine with normal fermentation and with a healthy microbiome. If I've got reduced fermentation or a reduced rate of fermentation, or I have an unbalanced microbiome, the amount of butyric acid or the amount of butyrate that's produced goes down. Butyrate is needed for those epithelial cells to reproduce. Butyrate is needed for those tight junctions to close and stay closed. So it begins to be a little bit, when you get intestinal inflammation, it gets to be like a snowball rolling downhill. Less butyrate, less epithelial reproduction, more open tight junctions, increased leaky gut, which then reduces the amount of butyric acid, and so on and so forth. And before you know it, you're way off to the right of that diagram that we showed you, and you've got intestinal epithelial cells just falling apart. And now you're in a pretty serious leaky gut situation. So now we have a source of butyric acid that we can actually include in a feed and feed a horse. We didn't have this tool until Butapearl came about. Butyric acid, I hope nobody is eating at the moment or has just finished supper, because I don't know how else to describe it, but butyric acid smells like vomit. That is the best way to describe it. And so it's not something that you can put into a feed and, you know, your horse go, oh, whoopee, you know, look what you're trying to feed me here. So what Butapearl is an encapsulated butyric acid, which makes it palatable, so the horse will actually consume it. The other reason it's encapsulated is you want that butyric acid to make it to the lower part of the small intestine and the large intestine. And if it was not encapsulated, as soon as it hit the stomach and the upper part of the small intestine, it would be absorbed into the body and become totally non-effective. So this is new technology that we're taking advantage of. Your trace minerals, plain and simple, very important. Zinc being one of the major trace minerals that's required for normal health of intestinal cells. There's a good and a bad, or a good and the ugly, as I call it, in relation to lipids. Medium chain fatty acids, primarily coconut products, they have been positioned as supporting good gut health, good intestinal integrity. That is a true statement as long as we're talking about a horse that has a healthy gut. So, and we find several nutrients or several dietary components that fall into this category. And what I mean by that is that if I've got a healthy gut, the omega-3s, the medium chain fatty acids that, you know, primarily come from your coconut products, they do in fact then help maintain that healthy gut. But should we get a horse that gets stressed out and that horse develops intestinal inflammation, or even to the point of leaky gut, then these particular dietary components that were good before now actually exacerbate that intestinal inflammation and exacerbate that leaky gut situation. So many times I will be contacted by somebody, or I'll actually be evaluating a horse, and they're a poster child for hindgut inflammation or leaky gut, and they've got the horse on some type of coconut product. That is the first thing I take my red pen and cross that off the list. So we have to stop feeding that, or your horse is basically never going to get better. In most cases, there's exceptions all the time, but in most cases, we have to remove those from the diet. Mycotoxins, moldy hay, dusty hay, even in the pastures. You know, people sometimes say, my horse is out on pasture and you're telling me he's got leaky gut. How can that be? You know, how much more laid back and stress-free can he possibly live? Your pastures can have mycotoxins in them, and mycotoxins can actually inflame the gut and trigger leaky gut also. So what do we do to try and prevent leaky gut in terms of dietary recommendations? As I mentioned earlier, provide as much fermentable fiber as possible. So that's good quality forage, pasture grass, good quality hay, hay pellets if you can't get good quality hay, shredded beet pulp because of its prebiotic properties. If you haven't already done so, reduce the intake of high starch grains and feeds as much as possible. Incorporate probiotics and prebiotics. Now, as long as if we're not in a full-blown leaky gut, but we feel like we're getting into insulin resistance, we're kind of into that in-between stage where we've got intestinal inflammation, but not necessarily full-blown leaky gut yet, those are the horses that are susceptible to developing insulin resistance or may already have insulin resistance. We know from research from multiple laboratories that fish oil, primarily the omega-3 fatty acid EPA that we find in fish oil, can actually improve insulin sensitivity. But keep in mind that's not an overnight fix. It takes months of daily feeding of fish oil before you're going to see much of a difference in insulin sensitivity. That's also going to depend upon your degree of insulin sensitivity. So if you've got a horse that's extremely insulin resistant, the fish oil is probably not going to make a significant difference in that horse's metabolism. So which horses are predisposed to dysbiosis and leaky gut? Well, keep in mind, no two horses are going to present the same. They're all individuals. You cannot necessarily use ultrasound examination. Another point I want to make. If your veterinarian does an ultrasound exam and turns and looks at you and says your horse has got thickened intestinal mucosa, what you know at that point is you already have substantial intestinal inflammation. We want to try and get that reversed before it ever gets to that point. So we're going to use symptoms, we're going to use behavior, history, as we talked about early on, to try and figure out if your horse has got hindgut inflammation or possibly even leaky gut. Keep in mind, imported horses have an above average predisposition to leaky gut or intestinal inflammation. Why? Because they're stressed. And stress is your biggest cause of this condition. Race horses, other high performance horses, due to their physical activity. Horses that are naturally, even without leaky gut, some horses are just naturally anxious, just like some people are more naturally anxious than others. Horses that have had recurrent colic situations. Horses that have gone through an antibiotic protocol. Horses that are in chronic pain. The pain itself raises cortisol levels, their stress hormone. That triggers intestinal inflammation and leaky gut. But secondary to that is oftentimes horses that are presenting with pain are given some type of nonsteroidal, bute, banamine, Previcox, whatever. All three of those will trigger intestinal inflammation and leaky gut. Horses with metabolic syndrome, horses under a lot of stress, doesn't matter if it's physical or emotional, will be more predisposed to leaky gut. So what do we look for? So we know which horses are more predisposed, but what are these symptoms that I referred to? The first one may be as simple as your horse is not performing to the previous level or the level you expect them to perform at. Your horse develops a change, or your horse's personality changes. That's the main thing I'm trying to say. The key word there is change. So a horse that used to be laid back now becomes grouchy, develops a leave me alone behavior. Your horse might resist forward motion. In other words, I just can't get him to go forward. I can't get him to engage his hind end. I can't get him to perform some of the movements, such as working in circles and bending around my leg or whatever it might be. They may develop a hyperreactive personality, but by the same token, they may go the other way. They may actually get extremely dull. But it's that change, that's the thing you're looking for. Also very common to hear somebody say, my horse is now resistant to my leg. Not always the right side, but usually the right side, because that's right where the right dorsal colon is, which is a major area for intestinal inflammation. They get cinchy, as we talked about before. Your horse might prefer to eat hay rather than grain. And you'll notice, you offer them, their feed, and they nibble at it. They go eat hay. They come back, nibble at their feed, go eat hay, go back and forth. When I see that type of intake behavior, I am very suspicious that I've got some type of intestinal dysfunction. Picky eater, by the way, that's another symptom that your microbiome is unbalanced. Horses are not normally picky eaters. So when a horse does develop a picky appetite, you have to wonder if you are dealing with some type of intestinal dysfunction. Not always, but it definitely needs to be considered. They'll get sunk in the flank area, out of balance with the rest of the body. A lot of horses that become more and more fit, especially race horses, they'll get, they'll tighten up, they'll tuck up, as we say, in that flank area. But the key word I'm referring to here is that sunk in area in the flank is out of balance with the rest of the body. That's what you're looking for. Constantly switching from one hind leg to the other while standing. They'll be tight in the hamstrings, tight in the back. And of course, now there's a lot of reasons why horses will be tight in the back and tight in the hamstrings, but intestinal dysfunction is one of them. They eat a lot, but they don't gain weight. Dull coat, poor hoof quality, multiple allergies, as we talked about. Horse improves when you give it omeprazole, but reverts back, as we discussed. Recurrent or chronic diarrhea, and or a horse that defecates normal road apples, but there's a fair amount of water that's associated with that. Those are all common symptoms of some type of hindgut issue. So with that, I thank you very much. And this is what we're all about. If you've got a horse that's similar to the one here on the left, what we want to do is try to help you get to one that's similar to the one on the right. So if we've got any questions, I'll be more than happy to field those. Okay.
For anybody
So,
who's
Christine?
watching on the video, you can send them in via the chat. I don't think I can see them, unfortunately, but if you do have any questions, please send them in through the chat right now, and Bill can answer them for you.
Okay, let me see here. How do I do that? I go back to this one. Message. Okay, thank you.